Hello, everyone. My name is Rachel McGill. I am the Healthcare Workforce Liaison for JMG. I work as a partner with Maine Health. And this series that we do webinar recordings with different healthcare practitioners to learn more specifically about their roles. We're very excited today. We're going to be talking about respiratory therapy. And we have with us Debbie, who is the Director of Respiratory Therapy and Pulmonary Medicine with Maine Medical Center. Debbie, welcome. Thank you for joining us.
Thank you for having me.
So, we like to start easy and talk about you as your individual career path. Could you talk about what that looks like? And I know you may have a long career path to discuss, but generally interested about how did you get to the role that you're at now? What did that look like? And did you always want to work in healthcare, or is that something that kind of just happened?
So when I was graduating from high school, my father was actually a faculty member at Northeastern University in Boston. And he came home and he said, if you want to go to Northeastern, you can go for free. What do you want to do? And I said, I have no clue. I had no clue in high school what I wanted to do. And so I read through the catalog and narrowed it down to a couple of programs that looked interesting. And I basically did eeny, meeny, miny, mo. I had never stepped foot in a hospital prior
Wow.
to going to school for respiratory therapy, but it turned out that I loved it.
Hmm.
I I've I went to Northeastern University, got my bachelor's in respiratory therapy with a specialty in critical care and neonatal pediatric intensive care. After I graduated from college, I moved to Maine. So I grew up in the Boston area. I moved to Maine
Hmm.
at that point. I had worked at several of the Boston hospitals. But when I moved to Maine, I got a job here full time at Maine Medical Center as a staff respiratory therapist. I immediately, that same summer, trained in the NICU and the PICU. Well, we didn't have a freestanding PICU, but I trained for the pediatric intensive care. It was embedded in the adult critical care. So my passion has always been premature babies and working with premature babies. But throughout my career, I've done a lot of different things, including adult critical care, cardiothoracic. So patients after they have open heart surgery, I've taken care of them. I've done neonatal pediatric transport. So we go on the Angel One ambulance and go
Oh.
pick up babies from all hospitals around Maine and bring them back here to go into our neonatal intensive care unit. So I've been very heavily involved in that. So for the first 20 years that I worked as a respiratory therapist, I was a staff therapist working all over the hospital, but focusing mostly neonatal pediatric. And that's kind of where my passion was. About 20 years into the career, I became interested in more career opportunities. We had developed a clinical ladder, which allows you to get more involved and grow as a professional without leaving the hospital. So, like a level one respiratory care practitioner is a new grad who's finishing their boards and doing their competency-based orientation. So we make sure you know how to do everything before we let you go. Um, and after you finish all that, you can move into a level two position. And the level two is our standard respiratory therapist. It's what most of our staff settle in as. But those that want to do more advanced care, like they want to train in the NICU, they want to train in the PICU. We do neurological monitoring, people who want to train in that. We have a team that sit extracorporeal membrane oxygenator devices, which is a big cardiovascular support system that's used.
Wow.
We have staff that do that. We have staff that do out-of-house transport. We have staff that do pulmonary function testing. So we have this whole gamut of different
Hmm.
specialties you can pick right here at Maine Medical Center to explore. And as you explore that and develop the expertise, you can then advance to a level three
Hmm.
respiratory care practitioner. And then if you want more leadership experience, We have like staff development specialists. We have leads for
Mm.
our specialty areas. That's a level 4. Going from level 1, level 2, level 3, level 4 is an 8% raise. So you're
Wow.
compensated, you get more skills, you get leadership skills. We provide leadership training and all of that. So about 20 years ago, I got more involved in that. I had all my kids by then, and I had the flexibility when I was having my children to go part-time, come back full-time, go part-time, go back full-time. So there's a lot of flexibility.
Mm.
We do 12-hour shifts, so I would be able to work 3 days a week, or when I went part-time, I worked 2 days a week. So I had the flexibility to work around daycare, my kids' activities, and that sort of thing, which is really great about a healthcare profession that I didn't
Yeah.
know when I was looking. When I was going eeny, meeny, miny, mo, I had no, um,
That's amazing.
yeah. And, it's really worked out for me. I eventually became the coordinator for the department, doing all of the scheduling and skill mix, assigning students. We do most of the clinicals for
Mm.
Southern Maine Community College here
Got
for
it.
respiratory therapy. We're talking to Kennebec Valley to do their clinicals as well, or
Mm.
some of them, to students that live in this area. And St. Joe's is actually in the midst of developing a respiratory care bachelor's program, and we're probably going to be doing some of their clinical as well. So we do a lot of teaching. Our staff does a lot of teaching. So I coordinated that. And then eventually I became a supervisor here. And I worked for a supervisor for a lot of years. And ultimately I worked my way up, and I'm now the director of the department. So I've had just about every job in the department. And
Yeah.
I've loved it. I've never regretted coming here. I've never regretted being a respiratory therapist. I consider respiratory therapy sort of the fire department of the hospital. Every
Mm.
emergency that goes on here, they want the respiratory therapy department to show up. And we swoop in, take care of the emergency, and then we swoop back out. So it's kind of like, I want to provide healthcare, but I really don't want to be like turning patients, changing the bed, changing the patient. That I just really want to, follow the critical care.
Mm-hmm.
Um, Respiratory therapy is a pretty good fit for that. You never get bored. Things change every single day. I would say that the 42 years I've been here, I've learned something new every day. It's a
That's
continuing
amazing.
learning experience for
Wow.
the employees here. It's always changing, always evolving. We're presented with different things every day. If you were to become a respiratory therapist, you could go to a small community hospital. You'd go in, you'd know what you do every day. You would go in. I've worked at community hospitals.
Mm-hmm.
You'd work in the emergency department. So if somebody came in a cardiac arrest, they call respiratory to come help with the airway and the breathing.
Mm-hmm.
Um, You'd work in critical care. So somebody that needed to be on a ventilator, which is the breathing machine used to keep somebody alive when they can't
Mm-hmm.
breathe on their own. No matter where you work, you'd be taking care of those devices. So the devices now are all computerized.
Mm.
So you have to be a little bit on the techie side for that type
Sure.
of work. But you still get, we do nebulized treatments. So like
Sure.
somebody with asthma that has trouble breathing, would give them inhaled medication. So we have the ability to spend part of our day going around visiting patients, doing their treatments, talking to them. So you still get that talking to
Mm.
patients, hands-on care, but you also are doing the techie, watching the equipment that's keeping them alive part as well. So it's kind of a
Yeah.
unique little niche in
Yeah.
healthcare that we
Oh my
provide.
gosh. I
Here at the medical center, we have, I think, 108 critical care beds right now.
Wow.
So
Wow.
we have neurocritical care, surgical critical care, medical critical care, pediatric critical care, neonatal critical care, cardiovascular critical care. So there's all different types. And my staff, for the most part, pick a place that they really love and they work there most of the time, but they have
Mhm.
the opportunity, if they're getting a little tired, to rotate into another area.
Oh, that's
Like,
amazing. Good.
we have some people that like to be the utility infielder where they just go in
Mhm.
where they're assigned to be
Yep.
and fill in when other people aren't here. So there's a lot of, I have people that worked NICU for many years and got tired of, working in that environment. And now we're doing rehab medicine where they're working with people who are trying to recover from being in critical care and get their lives back on the ground. So there's a lot of open doors, a lot of flexibility,
That's
and
amazing.
I've enjoyed it. I've enjoyed all of it.
Well, it surely comes through that you enjoy what you do. I would say I have so many follow-up questions for you, but I
Oh,
want to
absolutely.
start with, so you have been at Maine Health or Maine Medical Center for the entirety of your career. Is that correct?
No,
Okay.
I worked at Mass General and Children's
Okay.
Hospital in Boston before I moved to Maine. I've been here
Okay.
42 years, so I worked at
Wow.
a couple of community hospitals in the Boston area as well.
Okay.
But
I was curious to know, like, just with your longstanding relationship with Maine Health, like, what would you say is the best part about working for them? Just,
um, I love the flexibility. Like we have the ability to do something different every day.
yeah,
It's been a great organization to work for.
that's good.
I've like during the pandemic, we never ran out of protective equipment. We always had everything we needed to take care of the patients.
Mm.
They were very supportive of, working with the government to get us extra equipment in. We always had um, masks and gowns. None of us were wearing trash bags or any of that. And
Yeah,
that to me is just a sign of what Maine Health has always done well over
that's
the
good.
entirety of my career. They've taken care of their employees.
That's
And
good.
now
That's
looking
good to
at it
hear.
from a department director perspective, the human resource department really protects their employees. They really have their
Mhm.
back. I had one point had to testify in a court case,
Mm.
and Maine Med, worked with me. They made sure I had the time to work with the lawyers, so I understood what I was going to be talking about when I went in. I was going in as an expert witness,
Hmm.
and you know, I would never have had that opportunity in most other places.
Yeah. No,
Um,
that's I'm
yeah,
just curious. That's a little off script, but I was like, oh, I just
yeah,
have to ask because that's I know we're gonna get into the different roles of respiratory therapy, and you
yeah,
kind of I love that you highlighted that there's kind of the clinical ladder, right? So if you
yep,
wanted to just practice in the clinical side, there's ways that you can advance, but there's also that leadership side. So it's a little more, I don't want to say non-clinical, but you're doing more scheduling, administrative stuff in addition to possibly some clinical side. So
absolutely.
I do
And the
love
other
that.
piece I wanted to talk about, like, I went to Northeastern University. I got a bachelor's degree in respiratory therapy. The vast majority of my employees went to Southern Maine Community College and got an associate's degree in respiratory therapy.
Wow.
And Southern Maine Community College has a direct matriculation agreement with USM. So after you graduate and you start working,
Hmm.
you can finish up your bachelor's degree at USM online.
Oh, that's awesome.
Most of them have done it in 1 year to 2 years to
Yeah.
get their bachelor's degree.
I know, and
So
Maine Health does tuition assistance with
has
that too as a benefit, right? Yeah.
absolutely. So some have paid, had wanted to do it quick, so they spent some of their own money.
Hmm.
But the other piece is Maine Health is a nonprofit and qualifies for loan
Oh,
forgiveness, very similar
public
to the
service.
teacher's loan forgiveness.
Yep,
So
public
after 10
service. Yeah.
years, you can get loan forgiveness. Right now, the opportunities to go to the community college system are, it's free right now, right?
Right,
I don't know
right.
how long that's going to last, but even then, their tuition is so affordable. But
That's good.
I'm on the advisory board for Southern Maine
Great.
Community College. So I've worked very closely with that program over the years, so I know it very well.
Mhm.
They're very dedicated to putting out the best respiratory therapist. I love hiring the new grads from there. I've hired 6 of them that start in June.
Oh, that's from like a May graduation? Wow.
From the May graduation. 6 of them are starting in June. They're all taking their boards to get registered. The pass rate at Southern Maine Community College for the boards is over 98%. It's one of the higher
Wow.
performers in the country for passing the
Incredible.
boards. It's a wonderful program.
Wow. So
And
they'll
they
come
do
in
all,
at, I'm sorry, go ahead.
oh, they do all their critical care clinical be either here or at Central Maine Medical Center.
Okay.
And then they do go to all of the Southern Maine hospitals for other clinicals, but
Okay.
predominantly here at Maine Medical Center.
That's great. So they'll come in at level one. So an
Yes,
associate's degree, that's the education level that they need for a level one respiratory
correct,
therapist. Okay.
correct.
And then you said level two goes up to is that a bachelor's degree and
No,
additional? Oh, okay.
no, no, you can advance on the critical ladder without ever getting a
Oh,
bachelor's degree.
okay. So it's more internal training that's done.
Internal training, skills development,
Great.
getting credentials, like we require everyone to become a registered respiratory therapist. So when you graduate from the community college system, you're eligible to take the exams as a registered respiratory therapist.
Got it.
We require everyone to do that. That to me is showing that you have the competency to be a respiratory therapist by passing the boards.
Okay. And
It's
that's
very
is that
similar to
national?
becoming a registered nurse. You have to pass your
Okay.
boards and then you're a registered nurse.
Okay, and that's like a national certification. So not
Yep.
we want everyone to stay here in Maine and practice because I think one of the questions we're going to talk about is the kind of
The
worker
need.
shortage. Yes. But good to
Yes,
know
you
that they
could
can
take the
take that.
exams at H&R Block. You just schedule them
Oh,
there. You go on, you take them online.
okay.
Just 2 exams that, well, potentially 3, but everyone from the community colleges in Maine have all passed at the high cut level and only have to take the second exam.
Great.
We give you 6 months as a new employee to do that.
Great.
And then we do the competency-based training, which we start at a minimum of 12 weeks. Most new grads are 16 weeks of on-the-job training here, up to 20 weeks.
Wow.
And then this past year, we trained a couple of the new graduates right into the NICU. They wanted to go there. We had a need. So they spent their first 6 months in training,
Wow.
but they get their full paycheck, full benefits, all of that
That's
while
amazing.
we're training them.
That's
So,
amazing.
yeah.
Okay. Well, thank you for we talked a little bit about education, like qualifications training and the programs. So, and you mentioned some of these things in the kind of introduction because you've done so many roles, but
Yeah.
I'm curious, what does um, a day in the life look like for a respiratory therapist? You mentioned 12-hour shifts and that, in a hospital setting, but like what kinds of things would they do? Tasks would they perform? Who do they interact with? I know you did mention some of this, but maybe to elaborate a little bit
So
more.
we usually come in and we do report, which is a transfer of information on the patients we have. So the shifts overlap for about, because we cover 24/7.
Yeah.
So we have a respiratory therapist in every assignment, every day, every night, every day,
You have
7
to
days a
have.
week,
Yeah.
24 hours a day. So we have a half hour built in at the beginning and the end of each person's shift
Got it.
to transfer patient information. And then most people take a little bit of time and organize what their day is going to look like. If they're in the critical care unit, they're going to go around and do their initial device checks on all of their patients and do their patient assessments. So they go in and see their patients, check all their devices. They have a checklist of things that they have to do. And then mid-morning, they participate in interdisciplinary rounds. So the patient's physician team, the nurse, and the respiratory therapist and the pharmacist round with the patient, each patient in their unit. They participate in that, and then they take what they have gotten from that information to then go back and look and see what progress they can make with the patient. So we're looking as soon as somebody gets a tube in their throat for us to help them breathe, our goal is to get that tube back out. So we're looking at opportunities to wean them and to build their stamina we'll take them for whatever tests they need, things like that.
Mhm.
So we spend most of the day doing that kind of work. We'll help the nurse with like airway clearance, lung inflation, different things. So
Mhm.
we're the only person who is across the bed from the nurse 24 hours a day. There's
Mm.
always a respiratory therapist with the nurse in critical care. So that kind of day goes that way. So we'll see if we can get people off the ventilator, breathing on their own, and transfer it out of critical care. That's kind of what the critical care day looks like. Everybody that's a respiratory therapist loves working critical care. It's
Mm.
you have new patients frequently. You really get that opportunity to make a difference, and you see it. You see them coming in, and then their evolution to where they get to go home.
Yeah.
If you're assigned to what we call the floors, so the acute care units, you'll take report in the morning, same as the adult critical care, but people will have scheduled therapies that we go out and deliver at those scheduled
Mhm.
intervals. So
Okay.
you'll check in with the nurse on the floor, but we don't necessarily round with them like we do in critical care. We
Got
do a
it.
lot of communication in the medical record, which is electronic. So everything's in the computer chart.
Sure.
And we'll go visit the patients. A lot of stuff like that for a change of pace, because you get to know the
Right.
patients and talk to them.
Mm.
And it's kind of fun meeting different people.
Sure.
And but while you're covering those floors, you have an emergency pager as well. So if somebody takes a turn for the worse, they'll call us. So we are on the cardiac arrest team, but we're also on the team. We call it Code White now. Now it's going to be changing to a medical emergency. We're on the medical emergency team. So the critical care nurse and the respiratory therapist will actually go help the floor nurse look at their patient and try and determine, do they need to go to a higher level of care?
Mm.
Or is there something we can do to get them stable again so they can stay where they're at? So that's the floor care. The emergency room, we give them a very light load because you never know what's going to come through the door. This
Sure.
emergency room here is very, very busy. You could get, traumatic injuries. You could get a cardiac arrest. You could get somebody who is having trouble breathing coming in, and you're doing everything you can to stabilize them,
Mhm.
hopefully, so they can go back home, or to prepare them to go to critical care or stay in the hospital.
Mhm.
Um, That's a busy job, very
Yeah,
busy.
that sounds like you're rolling the dice of not knowing what's coming in
A
every
lot
day.
of people like it because
Mm.
it's so different every day. You really feel like you're part of a team.
Yeah.
You go into the emergency room, you have the physicians, the nurses, and the respiratory therapist looking at the patient, determining what they need, and getting them what they need and treating them. So
Yeah.
we have some people who love that. Other people like, yeah, I don't want to do that anymore. But I
Well,
find
I
a lot of the younger therapists that come in the department are really intrigued by doing that.
the emergency.
Yeah.
Well, and
Um,
it's nice you've mentioned before that, even though you start in a certain area of specialty, if you, for whatever reason, need I want to say slower pace because that doesn't sound like your job is at all slow, but a different
so
avenue that you can shift back and forth. So that is for that flexibility piece. That's huge.
one of the biggest programs I've been involved in is the neonatal pediatric critical care transport program. I'm sure many people have seen the Angel ambulances on the
Yeah.
highway.
Yeah.
I was here when we developed the program. We're now building our next ambulance for that program. But basically, that ambulance has a critical care unit in the back of it. We have everything we need to go to another hospital and take care of, like, we have babies that are 500 grams,
Oh,
like the size of a McDonald's cheeseburger. And
oh,
we stabilize them and bring them back to Maine Med to go into our neonatal intensive care unit. So you're out, you're
that's
not even in the building,
incredible.
you're gone for a
Yeah.
couple of hours.
Yeah,
And
that's
that's something I always loved. That was one of my
yeah.
favorite things to do. It's like, oh yeah, I'll go on the transport. I've been to every hospital in Maine,
That's
south of
amazing.
Bangor. I have not gone north of Bangor. And I've been to several hospitals in New Hampshire. I've gone down we drop babies off in Boston, so we go to Children's, Mass General,
Sure.
to bring babies down there. So it's always changing.
Mhm.
The other new program that has been in the last 5 or 6 years was the ECMO, the extracorporeal membrane oxygenation. That's been a real fun thing for some of our staff to learn. Like, it's really high tech.
So this is a machine, right? You said this in the intro. I was like, I have no idea what that is.
Yeah, it's kind of like the heart bypass machine that you go in when you have open heart surgery,
Yeah.
but it goes back into the intensive care unit with the patient. So we're bypassing either their lungs or their heart and lungs, so that we're putting all of the what they need in their blood, so that the heart and the lungs can rest and recover.
Wow.
So a lot of my staff do that now, and it's you sit one-on-one with the patient. It's
Hmm.
really, again, really techy. You're running
Mm.
a very complex machine, but they love it. It's just another challenge that you can take on. Most people are in the field 3 to 4 years before they feel ready to think
Yeah.
about doing that.
Sure.
We require, it's an interview process,
Hmm.
but yeah.
I'm thinking about students that, often when I'm talking with them, they're very interested in pediatrics in some capacity, or either or that, or labor and delivery. So
Yep,
I don't think that respiratory therapy may have been on their periphery or radar at all as being able to work with these patients. So I think that that's really
we
great
go
for
to
us to
all of the
hear.
high-risk deliveries, all of them. Some of
Yeah,
my
so
staff teach neonatal resuscitation. I was a neonatal resuscitation teacher. I was actually a pediatric advanced life support teacher. So I would
yeah,
teach paramedics, pediatric advanced life support. Um, so it's definitely a career path. We're
yeah.
very involved in the cystic fibrosis program that starts in pediatrics, and we have a therapist that works full-time doing clinic visits with cystic fibrosis patients. We are one of the primary assessors for pediatric asthma.
Hmm.
So
Yeah,
we,
so you interface quite a bit then.
quite a bit. And like I said, we go to all of the high-risk deliveries, and then the
Amazing.
NICU is all newborns.
Right. I think I truly don't know that it wasn't on my radar at all, but I hear that often as a theme of students being interested in working with kids in some capacity. So I think that this is a great path for
Absolutely.
them to, I'm excited we talked about that.
We don't have anybody here other than the cystic fibrosis, but like at Southern Maine Health Care, um, the pulmonologists there have respiratory therapists that work in their offices and do all of
Oh,
their inpatient testing, scheduling, and education. Um, the other thing that we have is pulmonary function lab. So if somebody's very data driven and detailed oriented, working in pulmonary function. So you're doing the breathing tests. So you're measuring their lung capacity. We do exercise testing. So somebody gets
oh,
on
right.
a bike or a treadmill and exercises, and we monitor their oxygenation and their heart rate. So we do that for cardiac and pulmonary patients. So this like
Yeah,
something for everybody.
right. I was gonna say, like, based off of your interest or skill set or what tend to enjoy working, it sounds like you can find a track for that
Yep.
in almost any capacity. So that's exciting.
We even have therapists that go over to New England Rehab and do pulmonary rehab over there,
Wow.
which is something I personally have never done. I really, professionally for me, neonatal pediatric was my jam.
Was your,
And then I
yeah.
got into management, but um, that we have people that's what they love. They love working with people and getting them back to their previous level of health. And
Yeah.
there's opportunities to do that as well. And you get associate's degree.
Right. Well, and yeah, I love that this conversation is progressing to this point too, because I think we're coming to the point where we want to talk about we're seeing shortages across the board in healthcare. physicians, and could you speak to what you're seeing within respiratory therapy? What are the needs?
So what
Yeah.
we're seeing, I actually meet with the Maine Hospital Association, and we've
Hmm.
been in the top three shortages
Wow.
in the state for several years. And I believe this year we've risen to the #1 shortage in the state.
Wow. That's
Um,
surprising to hear actually between like all of the conversation around nursing and CNAs and so respiratory therapy,
we're
wow.
right up there. We're right up there. Um, a lot of my staff were CNAs who went back to school to become
Hmm.
respiratory therapists.
Trained.
Like CNA is a good pathway. You can do it in 16 weeks or so.
Yep.
Um, and then go into the hospital and figure out what do you want to do. And a
Hmm.
lot of them say, we want to be a respiratory therapist because, you know, it's 2.5 years. There's a lot of prereqs you have to get done.
Hmm.
But it's 2.5 years or so. And you come out with a job that you immediately make an impact. And
Right.
our new grads that are starting next month are going to make $70,000 a year. So they're making over $30 an hour
Wow.
with a 2-year degree.
And that's a level one. And we talked
That's a
about,
level one.
I think you said
I
there were
have
8% between all three levels, right?
I have staff that are well over 100,000
Wow.
as their base pay, and we offer overtime, shift differentials.
Hmm.
You know, any healthcare that's open 24/7 is giving a lot of shift differentials. We have bonus programs.
I mean, and Maine Health's benefits package in general is very, very good for its employees.
Very
So, I
competitive,
mean,
yes.
on top of all of that, I
Yeah,
mean, so I'm just thinking of the calculations. If Southern Maine Community College is still tuition free for the next, I think, till 2026 graduates, is what I believe, you could come out with no educational debt or very minimal educational debt and then step into a high paying or a very competitive salary for not
yeah,
having for 2 years of 2.5 years of time.
yeah,
That's incredible.
absolutely. Yeah. I'm I could hire, I know for the next, we've already projected through the next decade, we are going to, based on the retirements and everything, that we're going
Hmm.
to need therapists for the next 10 years.
Wow.
Right now I have 25 openings, and that's after hiring 6 new grads. I have
Wow.
travelers from around the country, but respiratory therapy is a nationwide shortage. It's not just in Maine. It's
Hmm.
been documented as being one of the highest growth opportunity careers.
Yeah.
And the problem is we're kind of invisible. We got a
I,
little bit of a jolt with the
with,
pandemic because
yeah,
everybody has
COVID.
a
Yeah,
respiratory disease, and
sure.
you know, there was your respiratory therapist running down the hallway with the ventilator for the patient.
Sure.
Um, but I don't think people talk about it much. I don't think people know about it. We're really making an effort to become more visible. I know
Hmm.
there's been some ads. Southern Maine Community College has put out ads for a respiratory therapy program on TV and radio and things like that, because they're recognizing how many are needed, and the
Sure.
career's just growing.
Yeah.
We get called every day, hey, can you guys start doing this for us? And we're like, we're kind of drowning here,
Yeah, you
but
need more people.
we need more people.
Well, hopefully you have inspired some students by this conversation,
Yeah.
just in some way. I mean, we really appreciate the wealth of knowledge that you've just shared. And over the long history of your career, I think you were the right person definitely to speak to.
Well, and I interview every single person, and I have interviewed every single person that's come in here for the last 20 years. They've come from all kinds of backgrounds. Some of them have gone straight from high school,
Mhm.
especially ones that have done like taken some of the college courses ahead of time, like getting
Mhm.
like an algebra or a statistics class out of the way, or done some science credits. A lot of people have done this. They go to a prestigious university for a biology degree, And then they look at themselves and say, now what do I do?
Yeah, what's your
And
job?
what's your job?
Yeah.
And they end up going back to school for respiratory therapy.
Mm,
I would go one step further. I've had therapists that have worked with me in this department who have gone on to become certified nurse anesthetist,
mm,
physician assistants, and even physicians and anesthesiologists and RNs.
wow.
So they get the job as a respiratory therapist. And then if they want to keep going, they can continue working as a respiratory therapist while they pick away at the classes to
Right.
get your bachelor's degree and then ultimately go into grad school if
Right.
that's what they want to do. So it's a great launching pad to
Sure.
other careers as well.
Right. You could spend your whole career here like you and kind of
Right.
shift
Being a
around
respiratory therapist,
or
I have never
or
been bored.
yeah.
You know, I've been doing respiratory therapy over 45 years. I have never been bored, never. And I love the people I work with. I always have. They're fun people.
That's amazing.
Very close to the nurses. We work together with them. It's a fun job. It's
Yeah.
still a
Yeah,
job. I mean,
it
work is
is.
work. It's a
Yes.
job.
Yes. Well, maybe we'll kind of end the conversation with what kind of advice would you give to somebody who's interested, maybe a high school student? What can they do to help explore this a little bit more and figure out if this is really what they want?
I would say reach out to the respiratory programs at Southern Maine Community College or um, Kennebec Valley Community College in
Hmm.
Maine. There are other community colleges in Massachusetts, New Hampshire, Vermont, but those are the two in Maine. And talk to the program there. The other thing is to reach out to the respiratory therapy departments at the various hospitals and try to arrange a job shadow. Come in and see what we do.
Mm,
I would say would be the big things. Um, you do need some math. You do. So the minimum math that you need is a college level algebra or statistics.
okay.
I think they've taken some of the science requirements away, but I would expect that somebody would still need to be doing anatomy and physiology and that type of thing, but the school can
Yeah.
tell you exactly what you need. They
Yeah, with
run
the curriculum.
information sessions.
Mm. Yeah, I think looking at that curriculum just to see, make sure that you're aligning your high school, that's a really good point.
Yeah.
Coursework to set you up to step right into those classes when you
Otherwise, you might have
go
to
right
spend a
in.
year doing some of the prereqs to get into the
Sure,
program. All of
sure,
the credit, though, would be transferable
sure.
into a bachelor's degree program.
Right.
And I know,
Interesting.
like I said, USM, it's a straight matriculation. You
Yeah,
know, if you
that's
get your associates, you can go straight into University
yeah.
of Southern Maine. I have quite a few therapists that are doing Colby Sawyer in New
Mm,
Hampshire.
yep, yep.
And Boise State is the other one that a lot of people have gone to get the BSRT
Got it.
um,
Specifically. Okay.
specifically. Yeah.
Well, and for those JMG students on the call, SMCC, obviously we have specialists that sit there, so they have some additional wraparound support, and we do have other folks at USM as well, so they could have that continuum if they stayed within Maine to kind
Yeah.
of pursue their schooling.
But I would say, reach out to my department. We are always willing to talk to someone, um,
Mhm.
tell them what it's like, take them around, show them a little bit. We teach a lot here. We educate a lot. We teach respiratory students, nursing students, nurses, PA fellowship students do rotations with us. The pulmonary fellow physicians do rotations with us. ED physicians do rotations with us because they all want to learn a little bit about what we do because nobody else does what we do.
Yeah,
So
I learned a lot today. Thank you so much for
yeah,
spending your time and sharing your expertise with the students.
anytime.
Extremely grateful for this conversation, and you may be getting some follow-ups from some who watch this. So
Yeah,
thank
happy
you
to
very
talk to anybody.
much. Yeah, wonderful.